Support for this program is provided by the Foundation for Excellence in Louisiana Public Broadcasting and from viewers like you.
Hello and welcome to the very first Louisiana Spotlight Shorts. I'm reporting to you from Good Day Farms in Ruston, Louisiana, which is the largest medical marijuana grower in the entire state. Over the past couple years, the cannabis laws in Louisiana have gone through significant changes, leading to new industries like this one. But it also comes with a lot of confusion. People don't know what's legal, what's not, what substances can get you high, which ones are strictly for medical use. Tonight, our aim is to provide clarity, clear up any misconceptions, and delve into the advantages and possible risks of this budding industry.
One of the most significant changes to cannabis law was the signing of the 2018 Farm Bill, which permitted nationwide cultivation of hemp.
Through fires, floods, and freezing weather, we will always stand with the American farmers. The Farm Bill doubles the amount of farmers that they can borrow to expand and improve their farms.
After the Farm Bill's passing, the Louisiana legislature quickly drafted a bill to open the industrial hemp market here in Louisiana.
The 2018 Farm Bill put us in a position to put us first when you look at other states in growing industrial hemp.
Representative Clay Scheck-Snyder authored House Bill 491, which allowed Louisiana farmers to start growing hemp following the changes to the National Farm Bill. I've come to the Capitol to talk to Speaker Scheck-Snyder about this bill, as well as other hemp bills he's authored since then.
You ready, Mr. Speaker?
I'm ready.
Okay. Can you tell us more about House Bill 491? What was the goal whenever you were authoring this bill?
So 491 originated from the Farm Bill. The Farm Bill had set up a framework for states to go in and put in regulations to allow for an industry to start. It legalized industrial hemp, and what we wanted to do was to make sure that we had guidelines in place at that time in reflective of what the Farm Bill had presented to us. And basically what it did, it went in and gave us the framework to have regulations over the industrial hemp and cannabis community. Remember now, this was a fairly new industry that our Congress had put in place that they were trying to stimulate the economy and get things going and giving another option for farmers to be able to make a living. I don't think there's any other industry that we've started or any other program that we've started in the state that created the 2,500 businesses across the state and have these businesses start up without any state help whatsoever.
One of those 2,500 businesses that popped up following Speaker Scheck-Snyder's bill was Straight Weight Cannabis. I'm at their Baton Rouge location to speak with owner Jason Garcia.
Can you tell me what hemp laws were like when you first opened your business?
The hemp laws, we definitely didn't have the restrictions we have today. We made products from 25 milligram to 50 milligram cookies, gummies, brownies, Rice Krispie treats, Fruity Pebble treats. We make CBD lotions. We had about 129 products approved last year until about 3 weeks ago.
What changed?
Well, the law of 2022 supposedly went into effect on July the 1st, so that totally wiped away probably 90% of our products that we had approved.
What used to be right here?
You know, this shelf was full of Delta 8 coffee that we make in Monroe at our lab, where you can buy a bag of hemp-infused Delta 8 coffee or Delta 9 and make it at your own house, so you'd have THC coffee. We'd have that, we'd have chocolate, all kind of treats.
What was here?
Same thing here. We had Fruity Pebble treats, Rice Krispie treats, Honey Bunches of Oats.
So whenever I see a tray, they just had different treats and stuff.
Oh yeah,
they had
yeah,
those
it was
here.
full here, all over here. We just kind of had to rearrange some stuff because, like I said, 90% of our products got wiped out.
I will tell you that HB 758 was just a roadmap. Talking to the industry out there, most of them came back and said we'd like it to be 10 milligrams per serving or 50 milligrams per package. The other group said, look, We are comfortable with 5 milligrams per serving and 75 per package. So what I ended up doing was I said, you know what, we'll split it. We'll go 8 milligrams per serving and 50 milligrams per package. I think that's a comfortable area for both sides to be able to agree that they have a still successful product and it's safe for all of our constituents to use. The everyday person out there, even if you look at a bag of chips or a box of cereal, it says that a cup is a serving. Well, I mean, I would ask anybody in the room, when's the last time you measured your cereal by a cup, right? So our law that we passed was very clear that a single serving is that one whole gummy. Or if you had a bottle of water that may have it, that whole bottle of water cannot contain any more than that. Each year we updated the laws as the FDA and USDA would approve or disapprove of something. We tried to follow or mimic what they were doing. So whenever you've seen from 2020, 21, 22 to where we are at present day, whatever those changes were at that time, they were all in the guidelines of FDA and USDA.
In the 2022 bill, there is a federal preemption. How ATC interprets the law is different than what LDH interprets the law. And when you have two different agencies interpreting the law two different ways, what do you think that does to an industry?
Confuses it.
Confuses it. And that's what our industry is in the middle of, is confusion, because, you know, we're small business owners and entrepreneurs. We're trying to grow an industry and grow a business. And a lot of these people have spent their life savings. It's hard to run a business when you have government agencies that see it one way and another agency that sees it another, such as inhalables. Department of Health has put out these emergency rules saying that inhaling industrial hemp is a public health risk. We've still yet to hear an answer what the public health risk is. I brought it up, look, smoking cigarettes is a health risk, but we let people buy them every day. There's no serving size on alcohol. You can get as drunk as you want. There's not one case in history where somebody has died from inhaling industrial hemp. We want clarity, we want regulations, we want rules. Because look, there's bad actors in any industry. And we want to be regulated, but we want fair regulation.
The Louisiana Office of Alcohol and Tobacco Control is the government agency tasked with enforcing the hemp regulations in the state. I've come to speak with the ATC Commissioner, Ernest Leger, to hear about the issues his agency has faced due to the changing hemp laws.
Do you think people have a clear understanding of what's available to them and what they can and can't use?
Unfortunately, no. It's not despite best efforts. But we've literally had 3 major changes in 3 years. Just as people were getting used to what was, there now is what is. I think a lot of folks have been conveniently confused if you're ill-intentioned or you're not well-intentioned with respect to this. And they've seized on the fact that there is confusion and change in the law in order to make an argument that their profits are more important than public safety at the end of the day. And I just have a moral opposition to that. We regulate CBD exclusively from the retail and wholesale level. It's fairly easy to get a CBD permit. In fact, in a very short period of time, our state has over 2,500 permits for CBD, which far exceeded what the estimates were. Our current law allows for there to be 0.3% THC incidental to the cannabis product. Our challenges have come with determining what is a serving size. If you have a beverage that has THC, CBD concentration, is that beverage intended to be consumed in one serving, or is it divided into 4 servings? And the total amount of CBD and THC within that exceeds what would not cause a psychoactive effect. Does that present a public safety risk? When I talk about public safety, at this agency, investigate 100% of the complaints that come into the office. Some of these complaints are really scary. We have a complaint from a lady that went into a business and was told, hey, you know, take this drink, it'll relax you, without a disclosure as to what was in the drink, how much it was, and ended up in the hospital. It's a public safety issue from a business that has a permit from the agency that I represent.
Do we know what was in the drink at all?
We've had the product tested. There was over 120 milligrams of THC added to the 32-ounce beverage.
And she wasn't sure, well, she really didn't have a way to know what was in it.
No.
I really don't know a whole lot about this product. Is it true that you assured me that a person who is using this product does not use it to get high?
Absolutely.
And a person who is using this product could not get high?
Absolutely. It's a hemp-derived product, a THC, which takes tractor-trailer loads to even get the percentages of THC that you would need to get high.
Okay. Thank you, Mr. Speaker. Thank you, Mr. Speaker Pro Tem.
Thank you.
During the 2022 session, you said that it would take a truckload of these products to get people high. Do you still stand by that statement?
2022, when you looked at the way it was frameworked, that what we were talking about when I said a truckload is a raw material. So when I say a truckload, you go out and you harvest a tractor trailer load of hemp that's been out in the field. If you take that raw material and you have it on a truck and you decided to use it as a smokable, yes, you'd have to smoke a whole tractor trailer load to be able to get high.
All right, so this is Delta 9.
Correct.
And this is Delta 8.
Yep.
These are all Delta 9.
All these are Delta 9.
All right. I hear Delta 8 and Delta 9 over and over and over again,
Right.
but nobody's really explained what the actual difference is between the two strains.
Right.
Is there a difference?
Let me show you this.
Okay.
This is the molecule of Delta 8.
Okay.
This is the molecule of Delta 9.
All right.
You see how they're both different?
Yes.
That's the only difference.
It's just
The molecule structure.
the molecular makeup.
Molecular makeup, yep.
So that doesn't affect you differently?
Some people it may, some people it doesn't. Look at it, Delta 8 is maybe kind of a lighter version of Delta 9, if that makes sense.
But really it depends on the consumer.
Correct. That's
About-
all perception.
Okay. So then why is one, I guess, more regulated than the other?
They're both regulated.
Right, but it seems that more people have been focused on the Delta 9.
Because the federal law says that any cannabis that is over 0.3% Delta 9 THC, which is this one, is considered marijuana. Anything 0.3 or below is considered hemp. So they both look like the same seed, marijuana and hemp, but they got two different characteristics.
Well, there were articles that came out earlier this year talking about how Louisiana had just legalized recreational marijuana products because of Delta 8 and Delta 9.
So I would like to talk about that.
Sure.
During the legislative session, there was an email sent out talking about Speaker Shake Snyder's bill, basically insinuating as if they allow us to operate like a legitimate business in an industry, it would be creating recreational marijuana.
Right.
Well, that's not true because in theory, they already have recreational marijuana. It's just masked as medical.
Really? So you think medical marijuana is the same as recreational?
Well, think about this. Recreational marijuana is when you can go to a dispensary, show your ID, and buy what you want, correct?
Correct.
Medical marijuana is the same thing, it's just called medical. You make a phone call, you're guaranteed to get a card, okay, or your money back, and you only have to be 18 years old.
Is it that easy? Dr. Rome Sherrod is an ER physician and a medical marijuana doctor in Baton Rouge. I've come to his office to hear how he uses telehealth to diagnose medical marijuana patients.
I'm Dr. Rome Sherrod. I've been doing the medical THC recommendations for the last 4 years. I've been doing them since the beginning and just watched the program grow and grant access to our community.
Some people, especially people on the hemp industry side, have said that medical marijuana is basically the same thing as recreational marijuana because the recommendations can be as easy as a FaceTime call with your doctor. What do you say to that?
I disagree. The way I do business, all my patients, one, we do an interview, we do discuss the medication, we also discuss the pros and cons of using it. You know, this is not used just to have a good time. We have a process where we have to get documentation from the physicians, whether it be their medications or stuff, to make sure, because this is medical marijuana. This is not recreational.
For Jessica Potts, a special education teacher who has multiple sclerosis, cannabis has been a life changer.
I was on fentanyl patches that you change every 72 hours, to morphine, extended release, so every 12 hours when I got up, when I was going to bed, and 6 to 8 Percocets per day. And it wasn't helping. I mean, it just made it a dull ache, to where I could walk. I could stand and walk from point A to point B, but that's it.
So who suggested cannabis as an alternative to all of those medications?
I went to USC off the pleading from my mother because I was so depressed, because I was in so much pain. And the doctor there, she looked through all of my records, and I had done tests before I went out there. And she said, you should try vitamin D every day and cannabis for pain and get off all of these opioids. They're not doing you any good. So I had a 5 milligram gummy, and that took away all the pain that the morphine, the Loratabs, the fentanyl did not. In the midst of all this going on, in 2015, started lobbying and advocating for Louisiana to establish a medical program. So I went the medical route. I did what my doctors told me.
With the advocacy of Jessica and other patients like her, the legislature formed the framework for medical marijuana in Louisiana, with the eventual signing of a medical marijuana bill in 2016.
Okay, we have a new law. This is one of those bills that I believe will have a positive impact on people who need it the most. Simply put, the state of Louisiana should not interpose itself between doctors and patients. When the doctors believe that they have a patient who will benefit from medicinal marijuana.
The medical marijuana laws in Louisiana evolved over time, much like the hemp laws. Dr. Victor Chow was one of the first doctors to recommend medical marijuana in the state. I sat down with him to discuss the recent changes to the laws.
So when medical marijuana was actually legalized in Louisiana, there were certain conditions that you had to have to get a recommendation.
Yes.
What were they at the time?
Crohn's disease, epilepsy, multiple sclerosis, cachexia, cancer. There was about 10. And then later on, I think autism got added, PTSD got added, chronic pain got added. It brought the list to about 15. And then I think in a subsequent legislative session, they changed the wording of the law to where any debilitating medical condition could be recommended medical marijuana. There are a couple structural issues, I think, in the program that we have now. One is that there's only 2 growers / manufacturers / distributors. It's far less than what we see in other states of our size. So that limits the amount of medicine that could be outputted. So when there's less medical marijuana to go around, unfortunately, we see that in the form of higher prices. And also, I think structurally, the fact that there's only 10 pharmacies, again, it's much less than what we see in any other state of a comparable size. It just increases the distance that a patient has to go.
Capital Wellness Solutions was the first dispensary to open in the state of Louisiana. The products were limited to tinctures and oils when they first opened, but after the legislature included inhalables in 2022, the number of patients dramatically increased.
Thank you. Have a great day.
Thank you.
My name is Randy Meir. I have been a pharmacist since 2007. We dispensed the first product in August of 2019, and we were the first pharmacy in the state to have a patient. So earlier on, when we just had tinctures, and the physicians were having to be educated. We were ramping up the doctors joining the program so that they could tell patients about it. It was very slow. So to go from that to where we're at now today with flower and edibles and MDI inhalers, we're seeing about 4 times the amount of patients that we were then. We're so excited for the growth of this industry, especially as we're opening our satellite locations. We're looking at where our patients are having to travel to come here and where we can strategically put satellite locations for more access for patients. So the residents of Louisiana are going to see us go from 10 pharmacies to 30.
So let's talk about your products for a minute. What do you give your patients? What do they have access to here?
They have access to everything. So from flower to meter dose inhalers to edibles. You know, when we sit with a patient, we go through their chief complaint. So I would say that the main ones are usually anxiety, insomnia, wanting to sleep better at night, pain. It's amazing how many patients we help with pain management, and so many that reduce opiates.
You get your license and everything and take care of it.
So is this an example of the medication that you're taking?
Yes, and this is hemp flower. I know it looks...
Which one?
All of those. This is a CBD flower that is dusted with Delta-9. The Delta-9 is psychoactive. The only difference is this has medicinal benefits and I'm not using it for intoxication.
You helped advocate for the implementation of this medical marijuana bill, but none of the medications you're taking are actually coming from Louisiana pharmacies. Why is that?
Because I cannot afford them. It's either use the hemp-derived products, which do help, or move, or don't use anything.
The prices for the end user, the patient, have come down considerably from the beginning.
Really?
Oh, absolutely.
Why is that?
More access. So now, since we've improved legislatively the testing labs, it's days for them to get product approved. Before, it could go months. It would sit in the lab for months before it would get approved, and then we would run out of product. So the price was higher then just because it was not readily available. The grows had to go through so many more processes to get it to us. And now that it's readily available, we do not see supply issues. The prices have come down considerably.
I went to Ruston, Louisiana to see the largest medical marijuana grow operation in the state. Good Day Farm is a massive structure, 200,000 square feet, housing fields of plants and their subsequent products. The cultivators at Good Day took me on a tour of their facility, showing me every step of the process, from seed to sale, as they say. Good Day Farm is the cultivator of the LSU Ag Center. John Davis is the president. He's held that title since the inception of Good Day Farm in 2018. He's seen the cannabis industry evolve from the very beginning.
Well, we've talked to some medical marijuana patients, and some of them say they do prefer the hemp products because it's cheaper and they can afford that versus buying the medical marijuana that they could get maybe from a place like this.
Yeah, I respect and appreciate their perspective, but I'll give you some examples. And again, it's subjective. So a year ago, the vapes, the meter dose inhalers, those were retailing for $90 to $105. Now it's $40 to $50. An eighth, which is 3.5 grams of flower, is running $60 to $80 for an eighth. Today they're running $30 to $40, and they're consistently having $20 eighth sales. So why has that come down? Well, in big part, it's the testing. So we don't have to ration the products because now the testing is so quick. We can, whenever people need products, it's out. But we got to really take a step back. We're in, 18 months of the REAL program, and we're already competitively priced with Mississippi, with Arkansas, with Missouri. We're not Colorado or California that have been at this for over a decade, but they had the same pricing issues a decade ago when they began. We're not into this for a decade. We're into this since January of 22. And we've tried to fix every one of those bottlenecks and choke points, listening to the feedback of the patients, going to the legislature, advocating on behalf of the patients. They may not like the system, but we're constantly improving the system.
So how much attention do you guys focus on the hemp industry here in Louisiana and the laws regarding it?
Yeah, we pay very close attention to that. It's not that it's paying attention to competition. They do sell THC products. I mean, let's make no bones about it. They're selling THC products, we're selling THC products. So we're both selling the same main ingredient product. They are completely deregulated. We're strictly regulated. How is that possible? Isn't that an unconstitutional commerce framework? And I say that not lightly, but that's what it is. When you have two enterprises selling the same main ingredient and you treat them differently, that's a problem.
Medical marijuana does not want the hemp industry to exist.
Why do you think that is?
We're competition. The public wants our products.
Some people are saying that this is an unconstitutional business model and that the difference in regulation isn't fair.
We are regulated. We're one of the most regulated industries in this state. Think about it. Our laws have changed for the last 3 years, which means more regulation on our industry.
Well, we've talked to some people on the other side, and they think that the current laws favor the hemp industry, especially because people don't need a recommendation to come in and get the products. They can just come in and get what they want.
You know what? I would completely 1,000% agree with them. They don't need a prescription from us. You know why? Because it is federally legal to sell, consume, and manufacture industrial hemp, where it is not federally legal to sell marijuana in any form, medical or not.
People on the medical marijuana side and people on the hemp industry side, some are arguing that it's unconstitutional for them to not be regulated the same way if they sell the same product. Do you agree? I mean, what do you say to that topic?
I disagree. It's two different products. It's just like whiskey and beer. Two totally different products, and whiskey and beer are regulated differently as well. So I would say you regulate those products just like you would an opioid, just like you would a prescription drug, just like you would do anything else. You have to be specific in what you're doing. This is a hemp bill. It's a farm bill. This is something that the federal government said that is legal. Marijuana is not legal. Two totally different products.
It's understandable why some will be confused by the cannabis laws in our state. The laws have shifted year after year, and there are many differing opinions about how cannabis should be regulated. But one thing is clear, we've not seen the end of these law changes. With the federal farm bill up for renewal in September, it's likely the hemp laws in the country and the state will evolve even more. That's all the time we have for now. Thank you for tuning in, and good night.
For a copy of this program, call 1-800-973-7246 or go online to www.lpb.org.